Herpes zoster, commonly known as shingles, is a viral infection caused by the varicella-zoster virus VZV. This virus is the same one responsible for causing chickenpox. After a person recovers from chickenpox, the virus remains dormant in nerve tissue near the spinal cord and brain. However, in certain circumstances, the virus can reactivate, leading to the development of herpes zoster. In this comprehensive lesson, we will discuss the causes, symptoms, and treatment options for herpes zoster. Causes of herpes zoster. The primary cause of herpes zoster is the reactivation of the varicella-zoster virus in individuals who have previously had chickenpox. The reasons for viral reactivation are not fully understood, but several factors can increase the risk, including weakening of the immune system. A weakened immune system due to aging, stress, illness, or certain medications can make individuals more susceptible to herpes zoster. Advanced age. The incidence of herpes zoster increases with age, particularly after the age of 50. This is thought to be due to the natural decline in immune function that occur as we age. History of chickenpox. People who have had chickenpox are at risk of developing herpes zoster later in life. The virus remains dormant in nerve cells, and if reactivated, it travels along the nerve fibers to the skin, resulting in shingles. Symptoms of herpes zoster. The first symptom of herpes zoster is usually a tingling or burning sensation in a specific area of the skin. This is often followed by the appearance of a rash, which typically occurs in a band or a cluster on one side of the body. The rash can be extremely painful and is characterized by the following features. Red patches. Small red patches of skin appear usually on the trunk, but they can also occur on the face, limbs, or genital area. Number 2. Fluid-filled blisters. The red patches develop into fluid-filled blisters which are similar in appearance to chickenpox. These blisters can be very painful and may break open, forming crust. 3. Itching and sensitivity. The affected area may be itchy and sensitive to touch. Even light contact with clothing can cause discomfort. Nerve pain. Along with the rash, individuals often experience severe nerve pain, which can be sharp, stabbing, or burning in nature. This pain usually occurs in the same area as the rash and can persist long after the rash has healed. Other common symptoms of herpes zoster may include fever, headache, fatigue, and sensitivity to light. Treatment options for herpes zoster. It is recommended that consult your physician or medical specialist before starting any treatment. Some information is shared here for the purpose of knowledge and understanding only. While there is no cure for herpes zoster, early treatment can help alleviate symptoms, reduce the severity of the infection, and prevent complications. The primary goals of treatment may include antiviral medications. Prescription antiviral drugs such as acyclovir, valacyclovir, and famciclovir are commonly used to treat herpes zoster. These medications help to suppress the virus, reduce the duration of the rash, and alleviate pain. It is crucial to start antiviral treatment within 72 hours of the rash appearance to obtain the most significant benefit. Number 2. Pain management. Pain associated with herpes zoster can be severe and long-lasting. Over-the-counter pain relievers like acetaminophen or non-steroidal anti-inflammatory drugs, NSAIDs, may provide some relief. In more severe cases, prescription pain medications or topical anesthetics may be necessary. 3. Antiviral eye drops. If the herpes zoster rash affects the eye area, it is important to seek immediate medical attention. Antiviral eye drops or ointments may be prescribed to prevent complications and protect the eyes from potential damage. Number 4. Calamine lotion or wet compress. Applying calamine lotion or cool, wet compresses to the rash can help soothe itching and provide temporary relief. Prevention of complications. In some cases, herpes zoster can lead to complications such as post-therapeutic neuralgia, persistent nerve pain, bacterial skin infections, and eye-related problems. Vaccination, particularly with the herpes zoster vaccine, can reduce the risk of developing shingles or lessen the severity of symptoms if it does occur. In addition to medical treatment, self-care measures can help manage the symptoms and promote healing. These may include getting plenty of rest, practicing good hygiene to prevent secondary infections, avoiding scratching the rash, and keeping the affected area clean and dry. Final word. Herpes zoster or shingles is a viral infection caused by the reactivation of the varicella-zoster virus. It can lead to a painful rash and other distressing symptoms. Early medical intervention with antiviral medication and pain management strategies is crucial for reducing the severity and duration of the infection. If you suspect you have herpes zoster, it is essential to seek medical advice promptly from an accurate diagnosis and appropriate treatment.